morning, everybody. I'd like to welcome everyone to this program this afternoon. I have some staff members who have vested interest in stroke awareness, and that's what we'll be talking about this afternoon. The aims of this program is to reduce the impact and stroke in our community. We want to increase the community's Be Stroke Smart score. That means that we want to reduce our risk for stroke. We want to recognize stroke symptoms, especially quicker. We want to respond quickly at the first sign of stroke by calling 911. Funding for this program has been provided to the hospital from a grant received from the Department of Health and Human Services through Missouri, and ultimately that grant was provided by the CDC, which is the Centers for Disease Control, to Missouri. And we were one of 3 hospitals chosen to help with this grant. What we wish to do is increase the knowledge in our community about stroke and heart attack symptoms with this grant, and when to call 911, and develop better communications between the hospital and physician for follow-up care for elevated blood pressure and cholesterol levels. Joining me today for this discussion are our panel members. To my immediate left is Rita Broomfield. She's our Chief Nursing Officer at the hospital. And she and Julie, right next to her, who is our emergency room nursing director, have had a vested interest in attending stroke awareness programming for Missouri. And I'll let them tell you a little bit more about that. Dr. O'Donnell is to my right, and she also has been on the early efforts of Missouri to increase stroke awareness as well with the Missouri Project. So, what we're going to do, Rita's going to share with us a few stroke and heart disease facts.
Thanks, Sharon. I think it's important as far as this education process goes that we inform the public of some of the facts related to heart disease and stroke. This information comes from the Department of Health and Human Services and the Stroke Association, so they are reliable. This is reliable information. There are some pretty sobering facts in reality. Missouri now ranks as the 4th highest state in stroke incidence and 9th in heart disease, so that's a pretty staggering number. And 3 to 4% of the population is at risk for a stroke. That's 3 to 4 people in every 100 people. Missouri also has a higher rate compared to overall U.S. rate for the 7 risk factors for heart disease and stroke. And I want to go over those factors because these are many things that we have control of to prevent a stroke in ourselves or our family. High blood pressure is one of the risk factors, tobacco use, obesity, high cholesterol, lack of physical activity, not eating 5 fruit and vegetable servings daily, and diabetes. And then there's some interesting statistics with strokes as it relates to gender. Males die more frequently from heart disease. In stroke, actually, male and female are equal as far as deaths go. 80% of strokes can be prevented through the risk factor management, those 7 things that I mentioned earlier. Stroke kills twice as many women annually as does breast cancer, and I know that is a staggering figure because we know how many deaths there are from breast cancer. Women suffer greater disability from stroke than men, and of stroke survivors, 10% recover completely, a very low number, 25% recover with minor impairments, 40% experience moderate to severe impairments requiring special care, 10% require further care in a nursing home, and then 15% die shortly after stroke. So those are some pretty staggering numbers, and when you think about it, probably a huge impact on economics in a family if it were to strike that family.
So, Dr. O'Donnell, can you tell us a little bit about what is a stroke?
Definitely, and as we were just discussing before we started here, I think that there is confusion in some people's minds as to whether a stroke involves the heart or the brain. A stroke always involves the brain. Most strokes, 9 out of 10, involve a sudden lack of blood supply to a blood vessel in the brain. So depending on where the blood vessel is, a person will lose their speech, power in the arm, or whatever. The cause is either a blood clot coming up from the heart in somebody who has an irregular heart rhythm. Some irregular heart rhythms do not cause strokes, some do. Or a blood vessel in the neck called the carotid can be blocked with cholesterol. This is more common in diabetics and obviously in people with high cholesterol. So either of those two ways, a little clot can go up and just go out to a little blood vessel out in the periphery of the brain. Very rarely, although this used to be a much more common cause of stroke, is there a hemorrhage in the brain. In the old days when blood pressure wasn't well treated, it was much more common. A person would get the worst headache of their life, end up in the ER, and very often just die there. Now, there are aneurysms which tend to be in families, and they're just like a little bunch of grapes on a blood vessel. It's a weakness in a blood vessel, and usually it'll be a younger person who will get the worst headache of their life, go to the ER, and be diagnosed with an aneurysm and hopefully saved in ways that we're going to talk about later, surgery usually. And then when that happens, the doctors look at the rest of the family looking for aneurysms and often will diagnose an aneurysm that hasn't burst, which is the best thing of all, and it can be fixed. So the stroke where the little blood clot goes up from the neck or the heart, generally there's no headache. It's just suddenly, mom is slurring her speech or left arm is not working, whereas the one that is associated with the bleed is literally the worst headache. In both instances, obviously, a person should get to the emergency room, and we're going to talk about that more.
Okay. So, Julie, can you tell us a little bit about why we need to increase awareness in our community about stroke?
Sure, Sharon. Increasing awareness and educating our community allows them to have the knowledge to recognize stroke symptoms. And we want them to feel comfortable that if they even question what's going on, could they be having a stroke, or as we call it sometimes, a brain attack, that they don't wait to see if the symptoms improve, if they worsen. They just call 911 and get to the emergency room. Because the earlier care is given, if indeed it is a stroke, the more brain tissue, the more brain is saved. Because as Dr. O'Donnell described, with an ischemic stroke, there's a clot. And if you think of the clot, the tissue that's past the clot in the blood vessel is not getting oxygenated blood to the brain. So that part of the brain is being oxygen starved, and that's what creates the symptoms that we see: the difficulty with speech, the difficulty moving the extremity, that type of thing. And again, the same thing. We all get headaches, but if I get a headache that is the worst headache of my life, it comes on very abruptly and I feel very ill, this is not a typical headache for me. I need to go to the emergency room. I need to be checked immediately. I shouldn't call my neighbor to watch the dog. I should go immediately. I should call 911 and tell them I think I'm having a stroke, and should be taken to the emergency room. Again, the goal is to decrease the length of time from the onset of the symptoms until care is given so that brain tissue is saved.
So, Dr. O'Donnell, who's most at risk for stroke?
Well, people with high blood pressure, especially a long history of high blood pressure untreated. Diabetics, because diabetes is inherently a disease of blood vessels. People think of it as high blood sugar, but when you think of what diabetes does to people, it's all about the eyes, the kidneys, the blood vessels in the feet, and same thing, blood vessels in the head. High blood sugar is toxic to the walls of blood vessels, so more strokes. Obesity, not obesity per se itself, but because it tends to be associated with high blood pressure and high cholesterol. Smoking, because smoking is just toxic to every blood vessel in the body.
Well,
And-
it narrows the blood
Right,
vessels also.
spasm and causes disease of the blood vessel so that the blood vessel wants to hold on to more cholesterol. Sickle cell anemia in the African American community is associated with more strokes. And there's just an interesting statistic which comes out of Japan, which is that the Japanese, eat this great fish, rice, vegetable diet, so they have very little heart disease, but they have lots of strokes.
Why is that?
Because they eat a very salty diet. They have lots of soy and all that salty stuff, salted fish. And they began to see that nobody ever got a heart attack, but they were all getting strokes. So they looked at their diet and realized, so that's how powerful salt is. Salt, high blood pressure, stroke. So, and then of course, we women, because we have a higher life expectancy, so if we happen to have hypertension, we'll have it for more years. So it's just very much about, not that we don't want to live longer, we just want to control the risk factors so that we will live longer.
So, can you tell us, expand a little bit more about the symptoms of stroke that you were talking about earlier?
Commonest symptoms would be somebody's face suddenly droops, their arm suddenly becomes weak, and it's not a weakness associated with pain. So it's not like you hurt yourself and your arm hurts and you can't move it because you wrenched your shoulder or something. It's a painless inability to move, inability to walk. The one that I get a little worried about is sudden dizziness, because there's so many other causes of sudden dizziness, as we all know, and we see them all the time. But it's still much better to err on the side of thinking you have a stroke than to say, it's just my inner ear, unless you've had it before and you kind of know it.
It's my sinuses.
Exactly, exactly. Sudden confusion, and a lot of times family members will think somebody is confused who is having a stroke when actually they're just having trouble word finding. But the difference isn't really that important. If somebody is garbled, if their words are garbled, they can't seem, they're calling the clock is a chair, or they can't find the word for the clock, they need to come to the ER. If they're staggering, and then, of course, the sudden, severe, terrible headache.
Now, there's an easy way to remember all those symptoms.
Right.
Can you tell us a little bit
Sure.
about that?
It's called FAST, so, thinking of moving fast. F being for face. Ask the person to smile or show their gums. If, they're not able to do it, or one side is plainly different to the other, if the person has said that their face feels funny or it's drooping. Ask the person to raise both arms. I'm holding my arms up, it's easy. The person with the stroke, this arm just drifts down. Speech, ask the person to say a simple sentence, my name is, or whatever. And if they just can't say it, they can't find the words, they're slurring. And then T is for time. Just like you said, go, or Julie said, just go call 911. Don't hesitate. Don't be embarrassed. Nobody cares if you're wrong.
Yes.
What they care about is that you're wrong not to call.
Yes.
Because time is brain in
Absolutely.
this case.
So I'm going to speak to our risk for a stroke, and this is the preventive side of it. What we want to do is know our blood pressure number. Have it checked at least once a year. That can be done in a number of ways. The community center has a place that the hospital provides where you just stick your arm in. Any of the offices, and Julie, doesn't even the emergency room offer to check blood pressures if somebody walks in, or is that not the case anymore?
Well, because of EMTALA laws, where they're required to be seen by a physician if they present for care, and many times they don't want to be examined by a physician at that point. They just want their blood pressure checked. So we really encourage people to see their family doctor. Not that we won't do it,
Right.
but it starts a cascade of events whereby those people presenting for care, asking for services, they need to have a medical screening exam by a physician, and that's really not what they're wanting, but
Right.
then there's a conflict there with what the patient is wanting and what we need to provide once they present.
Yes.
So,
And
We can check it in the offices.
yes.
yes,
Yeah.
we are not under those same guidelines.
Also, county health department does go there.
Right.
Yes.
So that's another.
And the pharmacies have
And
them, right?
yes, they have
Yeah.
those automatic screeners too.
Right.
And so it's relatively easy to get your blood pressure checked. Absolutely, we all believe that everybody should have an annual physical exam anyway, just to put into place preventive measures for some of these more significant illnesses. If you experience palpitations, you definitely need to see your health provider. Atrial fib is one of these irregular heartbeats that we worry about and is strongly associated with stroke happening. So if you feel, even if it just turns out to be a skip beat, that's nothing. It still needs to be checked out. If you smoke, we highly encourage you to quit. My goal always with my patients is to get people to their retirement years in fairly good health, so that they, after they've worked all these years, they can enjoy time at their
Right.
leisure. So if you smoke, stop, because that will certainly affect your retirement years markedly. Control your alcohol use. It's been linked to stroke in many studies. The safe limit is always 2 per day. And if you think, oh, well, I'll put all my 2 per day on the weekend, so that becomes 14 in one day, that I've heard that reasoning too. That is not good also. Know your cholesterol number. If it is high, you need to work with your healthcare professional to control it. As Dr. O'Donnell said, that plaque buildup eventually narrows the arteries and slows circulation so clots can develop. Know your blood sugar number. We will check your blood sugar with just you stopping by, but really in truth it usually needs to be within a panel of other things that we like to do so that we can check its impact on your kidney function. If you have diabetes, work to get those blood sugar numbers under control. Exercise daily. This encourages blood vessel expansion so that blood can flow better. It also helps to reduce weight, control blood sugars, control blood pressure. There's so many advantages to getting 30 minutes of exercise daily that it's just hard to list them all. Enjoy a lower sodium and lower fat diet. Again, that will help you reduce the amount of fluid that you carry, as well as lower your calories so that you can lose weight. An easy way, there are many statistical studies that show if you make an effort to get 5 fruits and vegetables daily, you will lose weight. Address circulation problems if you are having symptoms such as dizziness, pain in the legs with walking, chest pain with your healthcare professional. Many of these are signs of they're signs of vascular disease or blood vessel disease, which can lead to problems with your heart or problems with your brain circulation. And then talk to your doctor to see if you are a candidate to take a daily low-dose aspirin. Some people are not candidates, and so you need to clarify that with your doctor. But many people can and should be taking aspirin. So Julie, can you tell us why it's important to recognize stroke symptoms early and get medical attention quickly?
Well, yeah, Sharon, as we talked about earlier, the sooner we recognize stroke symptoms and seek medical attention, the better the outcome can be, because treatment can be initiated early on. Treatment in our emergency room, if it is a clot stroke, when it is diagnosed, a neurologist needs to become involved at that point, and we have contact that we can make with a neurologist who can help our ER physician direct care based on the individual patient. There are many different circumstances that the ER doctor will discuss, such as your medical history, your medications, what type of symptoms you're experiencing, what type of stroke, whether it be a bleed or a clot that they feel it is at this point, at what location in the brain it is. And then the treatment will be tailored based on your symptoms. One thing that we can start in our emergency room is the clot buster drug called TPA. Now, a lot of neurologists elect to see the patient first before that is given, but some do elect to start it here and then have the patient transferred to them. We can do it either way, depending on the neurologist's preference. The neurologists that prefer to see the patients, we transfer them quickly to that neurologist. Generally, they're in a St. Louis hospital. They receive the patients there, and some of the interventions that they can do, if it's again a clot stroke, they have instruments now where they can actually insert a catheter into the large blood vessels. Usually it's in the groin and up to the neck and into the brain, where they can actually locate and remove the clot. They also have instrumentation where if the clot is in a location where they can get instrumentation to it, they can grasp and suction out the clot. And if it's a hemorrhagic stroke, sometimes they'll use what we call a clipping, where they'll actually locate the area of the blood vessel that has burst and literally put a metal clip on it to close that area. Now that involves entering from the skull side as opposed to going through the vessel. And there's also, when Dr. O'Donnell talked about, the grapes.
Oh, the bunch of grapes, the aneurysm.
The aneurysm, yeah, it slipped my mind.
Yeah.
Coiling for an aneurysm can be done, and what's done there is once the bulging is located on the vessel, instrumentation will actually be threaded into the vessel and material placed inside that area of bulging to reinforce it, so that the chances of it ever rupturing are greatly reduced. So those are just a variety of treatments. There's been lots of advances made in stroke care, but again, the best outcome is when treatment is initiated early on, as opposed to when hours have passed. Because the longer the time that passes, the more brain tissue is lost, and the worse the outcome can be. And what I mean by worse is more symptoms, permanent damage, because permanent damage means that the function of the arm won't come back. You may be able to do physical therapy and get some of it back, but the best outcomes are when care is given early.
Yes, and I think that the perception is out there, would you all agree, that people think, I have a stroke, there's nothing they can do for it, and that's not the case at
Not
all.
anymore. There's too
Not
many
at all
advances.
anymore.
Too many advances.
Mm-hmm. And in fact, they now have stroke teams for that very reason, and we're associated with the Midwest Stroke Network, which is at St. Louis U. And they are on 24 hours a day. There is somebody there waiting for a patient who comes to our ER. Our job is to get that CAT scan quickly, call up there, they can see the CAT scan as we're looking at it, and get them into a helicopter.
Yes, it's very important. Missouri's doing a lot of proactive things in regarding to stroke right now, so it's that important in our community. So does anybody have anything else to add? Then I'm going to wrap it up. We appreciate everybody's input today. If you have questions regarding stroke, you can contact me. I forgot to introduce myself earlier, but I'm Sharon Grass, and I'm a family nurse practitioner at the Point Base Family Health Center Clinic. or you can contact Dr. O'Donnell at her office, which is the Park Drive Clinic. And I'm sure Rita and Julie, you would be able to give information
We
to.
can refer them to the appropriate resource.
We will be posting at the end of this session some places where you can get information about stroke. It's directed at a layman's understanding, and that would be the American Stroke Association. The website will be on the slide at the end of this presentation. The National Health Institute of Neurologic Disorders and Stroke is available. And lastly, the National Library of Medicine also has a health topics section for lay people that will explain more in depth about stroke. So we thank you for your attention today. Should you need anything, please call us at the hospital. That would be St. Genevieve County Memorial, and we will be happy to answer any of your questions. Thank you.